Back pain is a very prevalent condition, and it's actually the second most common reason people seek medical attention after the common cold. Up to 90% of people at some point in their life will experience back pain, and every year, approximately 5% of the population will experience back pain.
It hinders your life, it hinders your day, and it often limits your time at work.
Low back pain is a constellation of symptoms in which a patient has significant discomfort in the region of their lumbar spine, which is the lower back, and this can often result in activity limitations and missed time at work. Back pain has a number of causes, and the initial evaluation of back pain is to detect a potentially serious underlying condition.
Musculoskeletal pain is the #1 cause of back pain. It's what I see every day. This can have a variety of causes such as muscular strain, a spasm, a ligamentous injury, or just joint irritation in your back.
Some of the more common conditions that can cause back pain as well include an infection of the spine, which could be of the bones of the spine or the intervertebral discs. Also, a muscular strain, rheumatologic conditions, or fractures can cause back pain.
An infection of the spine is very painful. It often is accompanied by fever, malaise, and chills. This patient is often immunocompromised, such as having diabetes or cancer.
Fortunately, most patients do not have a serious underlying condition. However, it is very important to rule out serious underlying pathology that could lead to permanent neurologic problems.
Fractures are another possible cause of back pain. Fractures can be constant pain that's generally worse with activity. Sometimes patients have brittle bones, osteoporosis, and this can be caused by small activities, not traumatic at all. Other patients have fractures when they've been in a motor vehicle accident or a traumatic injury. Some fractures need surgical intervention, while others may only need bracing and monitoring.
Degenerative disc disease is a potential cause of back pain as well. The intervertebral disc is a large non-vascularized structure in the body, and the function of the disc is to allow for support of the spinal column. The disc helps distribute the weight of the body with activity and movement. The disc has two parts. The outer part is called the annulus, and this is a thick fibrous ring. This encircles the inner part of the disc, which is called the nucleus. The nucleus is a softer portion of the disc. Over time, the wear and tear that daily activity places on the body can cause the nucleus to move outside of its normal location in the spinal column. This is known as a disc herniation. When a disc herniation moves close to a nerve or the spinal cord, neurologic symptoms may occur, such as pain.
On a positive note, less than 3% of people with back pain have a disc herniation, but most people think they have one. Disc herniations may just need conservative therapy, meaning time, medication, therapy. That's why it's so important to have a good rapport with your medical care provider. If conservative therapy has failed, that's where we come in for surgical intervention if necessary.
If someone experiences symptoms of neurologic dysfunction, they should contact their medical provider as a prompt evaluation may be necessary. When patients present to our clinic for evaluation, a thorough history and physical examination is very important for the first steps in our evaluation.
Typically, I will see patients first if they don't have any imaging, meaning diagnostic imaging. That's what we call a CT, an X-ray, or an MRI. Typically, when patients have X-rays or CT scans, they see me. This is when we decide whether conservative therapy is appropriate or we have red flags and we need to get diagnostic imaging immediately. If you or a loved one experiences any of the red flags we spoke about previously, please contact a healthcare provider.